Good morning. Welcome today. Oh, there's a hummingbird. 106 of the De-Stress series. We're doing a 16-week countdown at Quantum's Liberty. Good morning, birdies. There's your water. Today on the phone, I have Dan. Dan is a teenager in North Dakota. And there are some really interesting things going on out there. Ouch. There's some interesting things going around the United States right now. And so Dan's parents are emergency room nurses. And so the hospital, let's start tapping. So this De-Stress series is designed to get us through in a relaxing manner through the next 16 weeks. The virus is predicted to take about another 16-week surge across the world. As we know, it's the New York Times and the Washington Post staff have been reporting. Today's New York Times said the surge, keep on tapping. So this is blocking the neuron firing to the amygdala, which sends out the fight-flight cortisol levels and adrenaline to spike so that we go into stress response. So we're going to tap on this as we talk about the news, because Dan's parents are actually working in a hospital. Oh, it wasn't North Dakota, it's Indiana? Yeah. I have Dan on the phone, so we're going to be tapping along. Keep on tapping on the karate chop point, because we're going to de-stress through all of this news about the coronavirus, and we're just going to do the right thing that we have to do, irregardless whether our public health officials are choosing to stand up for what the people need to have done. And that's what's happening at the hospital where Dan's parents work, with Dr. Michelle Bache, B-A-C-H-E, according to the staff of the Washington Post, who works at Elkhart General. And so there's an increase of 37% from August. The hospitals are overwhelmed, and the mayors and the state and federal officials are refusing to request that everybody wear a mask or to not have gatherings greater than 100 people like they did this summer. And that helped to bring the numbers down. So right now the hospitals are overwhelmed, and because of politics, that's what they're saying. Like the Idaho governor is saying that the pandemic may or may not be occurring. And so Indiana hospitals are overwhelmed. Like Dr. Michelle Bache says, the New York Times reported that we had 90,000 cases yesterday. Yeah, so that's greater than one case every second. And that we reached 9 million cases. And it's the surge is the U.S. worst week ever this week. We have 229,800 dead. So hospitals in Colorado, keep on tapping, because this is going to block the neurons from going to the amygdala, sending out the fight-flight to the arms and legs. So the amygdala will not send the oxygen to the arms and legs, but instead it will stay in your prefrontal cortex, where you can think about the next right thing to do. So when we have an overwhelm from the news, we can be triggered in less than a second, even before we even know that we're being triggered. And it's 14 seconds later where we really begin to think, oh yeah, this is really disturbing me. And so what we want to do is we want to tap. You can tap right on this point whenever you feel overwhelmed from the news. We're also going to tap on health. We're going to get some really lovely neurotransmitters and hormones firing up and sloshing around our bodies so that we can have an immune boost. So if you have an overactive immune system, do not do the tapping. But if you'd like an immune boost, just know that doing the tapping for 10 minutes and meditation every day for 1 week will reduce your cortisol levels 37% in 1 week and raise your immunoglobulin levels 113%, including the IgAs, especially of the respiratory tract, where coronavirus loves to thrive. So we're going to be tapping on deserving any resistance to having that beautiful radiant health, and then we're going to tap on deserving the health, and then we're going to tap on envisioning that radiant, beautiful being as yourself with radiant health. And this will boost our immune system, lower your cortisol levels. And so we're going to tap as we're talking about this news, because we want to do the right thing. We want to read the news and know what scientists are telling us. And I understand that a lot of people might be afraid and triggered that people tell them what to do. I know that was a big issue for me in my childhood, but with the tapping, that's helped me to see that now I have another choice. This is a choice about my health and the health of those that I love in this community. So we're going to tap on some more of the news. Like New York Times reported today that Colorado, Illinois, New Mexico, the Great Plains states, and the Mountain West are all having hospitalizations of greater than 46% in the last week alone. Connecticut, LA is also keeping everybody at home. There are pandemic rules and lockdowns. France locked down 9 big cities, including Paris yesterday. So a lot of people were in gridlock trying to get out of Paris and avoid that. But Iran, Lebanon, Turkey, Germany, according to the New York Times, are all getting hammered with and locked down, which is good because we can control this. We can reduce the spread by using masks and maintaining 6 feet distance, and also having less than 3 families together in your bubble at one time. You can also reduce the number of people in a gathering. And also the virus is lipid soluble. Keep on tapping. So that means it breaks down with soap for 20 seconds while you're washing your hands, or when you come in from outdoors, wash your hair, have soap in your hair for 20 seconds, and then that will break down the lipid soluble membrane of the COVID-19 virus. So, and that's 1, 1,000, 2, 1,000, 3, 1,000. Okay, Dan? All right, so now that we have the news, we have been de-stressing as we've been hearing about the news, so that we know that there really is, I guess President Trump, the junior Trump said yesterday that the death rate had dropped, or Thursday, he said that the death rate had dropped to almost nothing, but actually there were 1,000 deaths on Thursday, and so that's one of the largest numbers. I guess there's usually 800 a day, but it is growing. So we need to know also that in El Paso, Texas, the New York Times reported that a judge in the county ordered a 2-week shutdown to reduce the numbers so the hospitals wouldn't be overwhelmed. But then the mayor and the state attorney general objected to this within hours of the ruling. So, despite whatever is going on in politics around you, you can know that these are, that we just have to look at the data. World Health Organization has free 17 sites, and the Lancet is really good. And also the CDC, Centers for Disease Control and Prevention, and Johns Hopkins. So feel free to look at those, and then you know that you just have to continue this. And scientists say that we really need to kind of buckle down for 16 weeks. So therefore, we're having the 106, today's 106 days till February 12th, which is 16 weeks out from here. So let's start on tapping on any resistance we have to radiant, perfect, beautiful health. All right, so even though, and then repeat after me, Dan's done this many times, so he knows all the tapping points. Even though, repeating, yeah, great. Even though I have this resistance to radiant health, first tune in, close your eyes for a minute, and take 3 deep breaths in and out, and imagine yourself in radiant, beautiful health. Imagine yourself running and skipping and joyful and playing basketball with your friends. But imagine yourself as yourself, running, walking, and being in vibrant health. Breathing well, walking, running well. Okay, open your eyes. Imagine if there's any resistance in your body to having that radiant health, like you're angry about something or you're afraid, feel where that resistance is inside of your body. And then I want you to write that in the air, and then write it as a number too. So in just like 2 or 3 words, give it a number, 0 to 10, where 10 is the most resistance you could ever have to having that beautiful vision of radiant health, and 0 is no resistance at all. And then write that in the sky. So, and then later on, after this tapping is done, notice if, let's say, your shoulders were up, you know, from overwhelm, or then notice if your shoulders came down, or, and then if your number came down too. And then do this every week, and I'll be back. I'll try to be back tomorrow. Okay, here we go. Repeat after me. Even though I have this resistance in my body to having radiant health, I deeply and completely love and accept myself exactly as I am. Even though I have this blockage within inside of me to feeling this beautiful love inside my body and brain, and feeling this bliss, I deeply and completely love and accept myself exactly as I am. Even though I'm feeling resistance to having this radiant image of myself being around in the community, with or without COVID-19 in my environment, with or without COVID-19 in my environment, good. I feel this resistance, and even though I have it, I deeply and completely forgive, trust, honor, respect, love, and accept myself exactly as I am. Inner eye, this resistance outside the eye, this resistance inside my body, under the eye, this resistance to having the perfect health. Under the nose, this resistance to receiving this beautiful health. Chin, this resistance to having the health in my body and mind. Collarbone point, this resistance to envisioning this image. Under the arm, this resistance to envisioning the image of perfect health. Top of the head, I deserve this beautiful health. Inside the eyebrow, I deserve this radiant image. Outside the eye, I can take it all in. Under the eye, I can do all the things I need to do. Stay under the eye to maintain a healthy environment for myself. I can wear a mask outdoors. I can wear a mask when I'm with other people. I can socially distance greater than 6 feet apart. I can maintain small numbers of people in a gathering. I can wash my hands for greater than 20 seconds with soap. and I can help myself and others be safer in this environment, with or without COVID-19. Under the nose, I've got this. Chin, go get 'em, Dan. Or you can put your own name in there. Collarbone point, I'm doing really good. Under the arm, I'm very aware of my health. Top of the head, sign me up for great health. Inside the eye, I have lovely neurotransmitters. Outside the eye, and beautiful hormones. Under the eye, flooding my brain and body. Under the nose, even as we speak. Chin point, science tells us this. Collarbone point, I am in balance in health. Under the arm, I have balanced health with or without COVID-19 in my environment. I have balanced health with or without COVID-19 in my environment. Top of the head. And I maintain radiant, beautiful visions of perfect health with exciting neurochemistry right here in my body, my brain, my mind, my spirit. Deep breath in, deep breath out. And 2 more breaths in and out. Tomorrow we'll do day 105 and we'll do the de-stress series. Thanks, Dan.